What's going on, everyone? This is Dr. Mike from Level Up Mental Health. I'm just back from the hospital where I work on the weekends, and I got my COVID-19 Pfizer shot, the first one. It went pretty well. I thought things were really streamlined at the hospital. They did a good job of getting us in and out pretty quickly. After you get the shot, you spend about 15 minutes in another auditorium just to make sure that you don't have any hypersensitivity reactions. So I sat around for 15 minutes, then I went and had breakfast for another 15 or 20 minutes or so. And yeah, I'm feeling good, feeling fine. So yeah, I was lucky enough to be part of tier one for getting the immunization. And I think that if you do meet qualifications to be a tier one recipient of the vaccination, you should go ahead and do it. And there's a few reasons for this. I think one, if you do qualify for tier one, you're probably either a high risk individual or you work with populations in the hospital where you're exposed to people who may have COVID-19 infections, or you could potentially become infected yourself. So if you are meeting criteria for tier one at this point, I would say go ahead and get the shot. The other reason I think it's a good idea to get the vaccine if you're a tier one individual is that it models good behavior. And as we know, or you may not know, people often learn through social learning. That is, if you see a behavior, you're more likely to follow suit. So if we have a lot of physicians, nurses, other healthcare workers who are showing that they themselves want to get this vaccine, then it's more likely that you as the average Joe would be likely to get the shot. There's always going to be people who are going to be completely against getting vaccines for whatever reason that they may have. And, quite frankly, there's not much we can do to change that. But I think the more people that we can get to get the vaccine, to practice other good behaviors such as wearing masks, washing hands, limiting social gatherings, the better and quicker we're going to do with this pandemic. And so my call to action to every doctor, nurse, other healthcare worker, especially respiratory therapists, is if you qualify to get the shot, go ahead and get it. The risk of getting COVID-19 is so much higher, and then further complications from COVID-19 afterwards is so high compared to any risk of anaphylaxis or another late-term effect from this vaccine that, statistically speaking, it makes a lot of sense to get the shot. And also continue to do, social distancing, mask wearing. Just because you're vaccinated doesn't mean you should stop wearing the mask. It's going to be very important that we continue to wear masks as this pandemic is still continuing to rampage through our country, with over 300,000 individuals have passed away at this point. So, if you get the vaccination and you stop wearing your mask, more people are going to see you doing that. They might think it's okay to take off their masks, but at this point, with something like 3,000 people dying a day, very important to continue wearing a mask, vaccinated or not. If you can get the vaccine, go ahead and get it. Do your own research about the risks and benefits of getting the vaccine versus getting COVID-19, and make an informed decision. And regardless if you get the vaccine or not, continue to wear your masks, wash your hands, maintain safe social distancing, especially as we're in the holiday season now. But it's really important for you guys to take care of yourselves and each other, and I'll see you next time.